Never run out of battery again with the INIU portable charger, the slimmest 10,000 mAh power bank that keeps your devices charged on the go. Stay powered up wherever you go. Click the link in the video description to shop now on Amazon.
NHS health workers to be sent house to house to tackle Britain's sickness crisis. Healthcare workers will be sent from house to house in bid to reduce hospital visits and reduce the number of people claiming sickness benefits. The program is part of a wider effort to increase the efficiency of the NHS and ease the burden on the system. It is hoped that the NHS scheme will also address issues such as debt, unemployment, and bereavement, which also place considerable strain on the system. According to Health Secretary Wee Streeting, early trials of the scheme have reduced hospital waiting times and visits by regular attendees to A and E, who he calls frequent flyers. He told The Telegraph, "I'm actually really interested in the community health worker model and the impact it's having." A pilot scheme, started in 2021 in Pimlico by a group of GPs, suggested that the measures could reduce hospital admissions by 10% and A and E visits by 7%. Don't miss, the mission is rescuing the NHS and raising the state pension latest. They have also shown that visits led to an 82% increased likelihood of attending cancer screening and NHS health checks, compared with homes that have not yet been visited. Under the proposals, which will be rolled out initially in 25 areas, health workers will be given patches of approximately 120 homes top, which they will make monthly visits where required. The scheme would also allow healthcare workers to identify and advise on issues such as mold and damp, poverty, loneliness, and unpaid bills. The plans have been likened to the return of a family doctor who makes regular visits, but critics have labeled the level of government interference as being like the nanny state on steroids. Don't miss, nurses forced to go to court to stop men using their changing rooms latest. The iconic seaside town, officially named Britain's most miserable latest. Channel 4-star, ashamed, after warning from doctor exposed hidden health battle latest. We use your sign-up to provide content in ways you've consented to and to improve our understanding of you. This may include adverts from us and third parties based on our understanding. You can unsubscribe at any time. Read our privacy policy. The scheme has been used to great effect in Brazil, with the mastermind behind the proposals, Dr. Matthew Harris, having worked as a GP there between 1999 and 2003. The model in the South American country has been praised for helping to reduce heart condition-related deaths by more than a third. Dr. Harris said, "When it comes to concern around state interference or nanny state, you could be forgiven for thinking that this is doing that on steroids. It's knocking on doors, and you might be forgiven for thinking it's interference, but it's actually giving control back to the resident." It is believed that if the scheme is targeted at the areas with the highest need, it will cost around £300 million.